A 67-year-old man presents to the emergency department with a 6-hour history of chest pain radiating to his back. He describes the initial pain as 11/10 and tearing. He has a past medical history of hypertension and type 2 diabetes. His ECG shows a normal sinus rhythm. His chest X-ray shows a widened mediastinum. His observations are recorded as heart rate 89 beats minute, blood pressure 195 by 106 mmHg, respiratory rate 20 breaths per minute, oxygen saturations 98% on air, temperature 36.9 degrees Celsius. What treatment should this patient receive? Options are A. Intravenous leptilol. B. Intravenous sodium nitroprusside. C. Intravenous glyceryl trinitrate. D. Intravenous amlodipine. E. Aspirin 300 mg orally. Answer is A. Intravenous leptilol. This patient has an aortic dissection. Intravenous beta blockade is essential to reduce the continued pulsatile force on the already thinned walls of the falls channel. Beta blockade may prevent further propagation of the dissection and reduces the risk of acute rupture. The risk of therapy is low. Intravenous beta blockade is used to achieve a heart rate less than 60 beats per minute and systolic blood pressure less than 120 mmHg. A 54-year-old man is brought to the emergency department complaining of central chest pain. He is overweight, BMI 33, and smokes 20 cigarettes a day. His ECG shows ST elevation in leads V5 and 6, I and AVL. You diagnose AST elevation myocardial infarction, STEMI. Which myocardial area is most likely affected? Options are A. Septal, B. Anterior, C. Lateral, D. Anterolateral, E. Inferior. Answer is C. Lateral wall. Leads V5 and 6, I and AVL best represent the lateral myocardium. A 43-year-old woman presents to the emergency department with palpitations. She has no other symptoms. She is prescribed risperidone for schizophrenia and recently completed a course of erythromycin for a chest infection. An ECG is performed at triage. Her BP is 130/80. What is the management of this condition? Options are A. Amiodarone 300 mg IV. B. Immediate synchronized cardioversion. C. Magnesium sulfate 2 grams IV. D. Adenosine 6 mg IV. E. Vagal maneuvers. Answer is C. Magnesium sulfate 2 grams IV. Long QT syndrome, LQTS, is a genetic or acquired condition characterized by a prolonged QT interval on the surface ECG and is associated with a high risk of sudden cardiac death due to ventricular tachyarrhythmias or torsades de points. Point management of torsade de points. Stop QT prolonging drugs. Correct electrolyte abnormalities. Give magnesium sulfate 2 grams IV over 10 minutes. Obtain expert help. Arrange immediate synchronized cardioversion if adverse features develop.